Dr. Jen Brix. She is here today from Natural Factors to talk about stress management. So we're going to hand it over to Jen. And thank you, everybody, for joining us. So here we go.
Wonderful. Thank you, Michelle. And thank you, everyone who's joining me today, whether it's the afternoon or the evening for you. Happy Tuesday. We're going to speak today about stress management, what that might mean for you, how you can kind of target some of these interesting times that we're in, and how that might be affecting you, your family members, so that you can get a better sleep, feel better, and just sort of combat those stress levels. Just a quick disclaimer. Let's get over to the next page here. Well, who I am, I'm a naturopathic physician, and I practice in Kelowna, BC. I've been practicing for just over 11 years, and I do have a passion for digestive health, hormone health, and brain health. And as we know, stress does affect all of these components quite significantly. I am also an educator for both Assured Naturals and Natural Factors. So I'm going to be discussing some products today that I've used with my patients. And again, really what I'm recommending, of course, is stuff that you should always connect with your healthcare practitioner about before you start. And this today is not a substitute for professional medical advice, diagnosis, or treatment. But what we will get into today is essentially sort of learning about what stress is, what it might mean for you, what it's doing in your body, and how to combat that. So how does stress contribute to disease? We'll also cover what are some contributing factors to anxiety and insomnia, what nutrients, so from foods as well as herbs or other supplements that can be used to support a healthy stress response in your body, and how nutraceuticals, or again, natural health products, can prevent and balance anxiety and improve sleep. Now, stress is in the news. Undoubtedly, we're hearing a lot of news about other health concerns like the immune system, but stress is really a big key part of this. So, and I mean, it's been in the news for a long time, but it is starting to become a bit of a way of life, especially again with the situation that we're in at the moment. And again, if you've asked your family or friends, how are they doing? A lot of people lately are saying they're feeling a little bit more anxiety, they're feeling a bit more burnt out, they might have more time on their hands if they're not working at the moment, but that's not really necessarily improving their stress levels. It might be adding to the stress. They might not be so busy, but they're definitely feeling that impact. So financially, right, we are all, a lot of us are experiencing this right now. So Canadians are financially stressed and would switch to a lower paying job in a heartbeat for this one perk. And we're reporting skyrocketing stress levels. So 70% of employees in one study said that their stress levels had increased, with more than half feeling the strain on a daily basis. So we're all feeling it. Now, stress is normal. Stress is sort of something that our bodies are meant to adapt to. Stress, essentially, though, is a pressure or a tension exerted on something. So you know what a physical stress is. If you push on a hard table, that table pushes back. That's a stress that is being experienced by both objects. But there's also mental emotional stress, which is really what we're talking about today. Those can be due to sudden traumatic experiences, but they can also be due to sort of that continuing pressures or irritations that wear you down. This might be, family members, relationships, where a lot of us are sort of stuck at home more, right? And we're looking how to cope, to work alongside maybe your partner, or balancing, homeschooling or cooking at home more, right? These are maybe fun at first, but they can actually continually put pressure and really increase that stressful burden. Even positive events, so weddings and births, of course, cause a lot of stress because they're a large change. A lot goes into planning and preparation, but they really do, change. They can change your lives once, for example, birth of a baby. And in world events, I threw this one in there because, of course, we're all in this right now. We're all experiencing, the entire planet really experiencing this current situation. So know that the body responds, your body responds very much the same, whether there's a positive or negative stress going on in your body. So we know this, we know that the mind can control a lot of our physiological responses. A really good thing I sometimes do with my patients is I have them imagine taking a lemon and, you know, rolling that lemon really hard on the surface of the counter, and then cutting into that lemon, and then taking that lemon and squeezing it into their mouth or biting it, right? And some of you may be experiencing this right now, but that can actually cause you to salivate just by thinking about that, right? You're feeling it here, right? Because your brain can actually cause a physiological reaction or cause your body to make more saliva, even though there's no lemon there at all. And so the same goes for stress, where you can think things, you can experience things in your mind, and that can create a physiological response in your body. Just like, you know, you're under stress, you might have butterflies in your stomach, or your heart rate goes up. The stress is also very individual. So people perceive stress differently, and perception is very important when it comes to acknowledging your own stress levels and what to sort of do to combat that. So there was a study that looked at 30,000 adults over a period of 8 years, and they actually asked this group if they were under a lot of stress, and then they asked them if they think that stress is harmful. And after that 8-year period, they actually used public records to see who had died, and they noticed that the people who had experienced a lot of stress and believed that stress to be harmful had a 43% increased risk of dying. And interestingly, people who did not view stress as harmful actually had the lowest risk of dying, regardless of what their stress level was. So again, perception plays a really important role here. And that's why just acknowledging where your stressors may be and how your body or your mind or your emotions respond to the stress in your life. And you can see this is from Statistics Canada. So we don't have this year's, and I imagine the numbers will have gone up, but you can see sort of the age 18 to 64. So the three groups, they're kind of in the middle. The majority of the people that have a higher amount of perceived life stress. So it's about 25% or a little bit higher than the population. And again, I imagine, you know, when these numbers come out for 2020, the total numbers will probably increase because we are all experiencing more or different types of stress. And unfortunately, I feel that we might see those numbers really jump in that 65-year and over age bracket. So being negative only makes a difficult journey more difficult. So you may be given a cactus, but you don't have to sit on it. And this is my analogy of perception, that again, when something comes into your life, or whether it's a deadline or, you know, you're in a traffic jam, you can decide to perceive that as being very stressful, or you can kind of talk yourself out of it, or you can combat it with really supporting your body with good food and certain nutrients. All right, so again, a few other statistics, which is something to be really aware of for those of you. I'm not sure how many adolescents are on this call, but for any parents of adolescents, we are seeing that number really increase in that demographic. So there is a bit of an anxiety epidemic. We know that there's a dramatic spike in people suffering from chronic anxiety, and teens have been dubbed the most anxious generation. So young people aged 15 to 24 are more likely to experience mental illness, and 41% of Canadians are at high risk for mental health issues. In 2014, again, I only have these numbers from this year, but depression was the number one cause of illness and disability in adolescents. So again, if you're a parent out there and you may be noticing those signs of depression, or you want to check in with your kids at this time of year, right? A lot of graduations are not happening, and you know, summer jobs might not be happening. So it's a good time to kind of check in with your kids and just making sure that you know, if they need any support from you or outside of the family circle, that might be an important thing to consider. All right, so again, it's good to identify what stresses you out. So acknowledging what that might be for you. It could be your job, it could be lack of sleep, which causes stress for many reasons. It could be media addiction. So being addicted to screens, again, you might not perceive that as being stressful. You might not think that that is really stressful, but it could be, affecting your eyes, causing eye strain, affecting melatonin levels because of that blue light. Money, so finances, health, poor nutrition, and relationships all also contribute to that. And we see that about 90% of all illnesses actually are stress related. So 90%, that might be even higher, but definitely a large percentage. So some of the diseases or some of the concerns that chronic stress puts you at risk, there's a list here and it's definitely not exhaustive. We're going to go through some of these today, just really in how stress can impact that and how to really support the body. So depression and anxiety. We'll also talk about insomnia, but we also have OCD, ADHD, and ADD on there, memory problems, including dementia, heart disease, that's a big one, immune system rundown, also very important at this time of year, considering what we're going through, and then weight gain, fertility concerns, and digestive disturbances, which I think are the three main ones that I see in my clinic. All right, so we're going to talk about how to take charge of your health, and the things that I'm going to speak about moving forward are going to kind of target one of these three important pillars for healthy well-being and happiness. So supporting how to support a healthy foundation. When I discuss a healthy foundation, I really mean all the other working parts. And by that, I really mean digestive health in a lot of ways. We're not going to get into that. That's a whole nother topic of conversation, but making sure your deficiencies have been dealt with. So if you have nutrient deficiencies, you want to make sure those are, topped up, as well as if you do have any gut issues. If you suffer from IBS or IBD, or you know that your digestion just isn't top notch, you get bloated often, etc., you might not have the best ability to absorb things that you might put into your body. So whether it's from food or supplements, if you can't absorb the nutrients that are important for you, or herbs, etc., it's not going to do much, right? It's better to support that foundation, heal any issues there, so you're not really flushing things down the toilet. And then we'll talk a little bit about, again, how to improve your sleep, and then also focus on balancing that stress response. All right, so again, let's do a quick physiology review. The adrenal glands are pivotal in stress as well as insomnia. Your adrenal glands sit on top of your kidneys. So we have two of them, and they produce lots of different things, including hormones and neurotransmitters. They're often called the stress glands because they help our bodies to adapt to stress. But constant stress on these delicate little glands can actually lead to adrenal exhaustion. So those adrenal glands can actually get tired. They can become deficient in their ability to produce the correct amount and number of hormones and neurotransmitters. The two major chemicals that they secrete that we're going to focus on today, of course, are adrenaline, which many of you are probably familiar with. If you've ever had an adrenaline rush, and then, of course, cortisol. So to simplify the hormone pathway here, it all starts at the level of the brain, and that's, again, why what we think can definitely affect the rest of what's going on in our body. But it starts at the hypothalamus, feeding into the pituitary gland, which then causes the stimulation of the adrenal glands to release, in the case of what we're talking about today, cortisol and adrenaline and noradrenaline, or epinephrine and norepinephrine. Many of you are probably familiar with the fight or flight response, which is a direct stimulation of this. Again, that's sort of the increased heart rate, the clammy hands, the dilated pupils, the running from a bear or fighting a lion reaction. So that is actually your first stage of stress. So we, as naturopaths, I always like to see where somebody is when we're talking about adrenal health. And these three stages are not stages that are occurring necessarily back to back. So Often the alarm stage, which is we call stage 1, that is when you're younger and you're experiencing stress, and every time you have a stressor, you go into sort of the fight or flight reaction, right? So again, fight or flight, you release your adrenals release high adrenaline and cortisol. Over time, so many days or weeks or months of this alarm stage will then put you into stage 2. And that's called the resistance stage. And most people stay in this stage for a lot of their lifetime. And this is when our body's in the coping and adapting scenario. So our adrenals can release adrenaline and cortisol, but you have dips. So it's able to react to stressors, but you'll find periods of time where things are actually low. And that's why energy levels can really shift at this point. And then the third stage is the exhaustion stage. And this again would occur once you've been in that resistance stage for quite a long period of time, or you've had quite severe levels of stress for maybe a shorter amount of time. So severe PTSD can push you right into exhaustion quite quickly. This is when your cortisol is actually low. So that's when your adrenal glands are burnt out and their ability to secrete cortisol is very impacted. And actually at this point we see the onset of stress pathologies. So again, this is where we'd see more serious issues. We'd see chronic fatigue, fibromyalgia, more serious cardiovascular issues and diabetes, and more serious depression and anxiety. So really what we want to do is prevent getting there ever. And if we're in the resistance stage, where most of us are, is how to make sure we keep our body healthy so we can maintain that, we can continue to cope with stresses that we're exposed to, and we don't get into that more pathological stage. So again, in the first stage, you can kind of see here, hopefully you can see my cursor. If you're exposed to a stress and you're going through fight or flight, your adrenaline spikes and then it drops. But you'll see that about halfway through that period of time when the adrenaline is being secreted, that's when your cortisol starts to creep up. So again, I mentioned adrenaline giving that fight or flight, the adrenaline rush. Most of you should be, aware of what that feels like. Cortisol is secreted about 2 hours after that initial reaction. So when someone says, "Oh, I'm so stressed out, my cortisol is so high," that's quite inaccurate because you don't really feel cortisol as much as you feel the adrenaline. Cortisol actually comes in as an anti-inflammatory. Cortisol starts to suppress everything. It starts to try to bring that body right down to deal with that adrenaline rush. That's why people get cortisone shots, into their inflamed joints, right, into their arthritis to really calm things down. So you notice that in this stage, this person's cortisol then comes down nicely as we'd like to see it. Now, more appropriately, we're maybe not exposed to one thing every day. We might be exposed to multiple stressors, and that's what's happening in the second graph here. You've got the adrenaline spikes occurring, but what's interesting is you'll see that the cortisol spikes, but it doesn't actually get a chance to get all the way back down to zero. The next stressor happens. So say, you're in a bit of a traffic jam getting to work, then you get to work and one of your coworkers says something, or you get handed another project when you're already, overwhelmed, your cortisol will then spike further high, dealing with that second adrenaline shot. And then it continues up and up and up, depending on, again, how many stressors you have that day. And that's what starts to burn out or fatigue the adrenals, is that constant secretion of cortisol rather than, having it come back down to zero. So symptoms of that alarm stage, again, that's elevated cortisol. You're often in fight or flight, or you're easy to get into fight or flight. You start to desire and crave foods like fatty foods and carbs, right, to fuel that. Your serotonin, so your happy neurotransmitter can become depleted. This actually also increases cravings and anxiety. You start to see increases in blood sugar and insulin, and that's where we can get that weight gain coming on. Testosterone can go down, causing muscle loss. Our melatonin is inhibited, which definitely impacts our sleep. And then we can get a reduction, if, you know, more so effective or impactful in women, which is decreasing of progesterone and then that interference with the thyroid gland. And belly fat, right? That's where we start to see our body storing more fat because it wants to store that for energy. And you start to get that kind of spare tire effect happening. So again, the symptoms of adrenal fatigue, you'll see more inflammation in the body, more mood changes, sleep disturbances, cravings, feeling overwhelmed, getting that, you know, that increased belly fat, cold hands or feet because of the connection with the thyroid. We see maybe more pain. Maybe it's low back pain or arthritis. Allergies and asthma can flare up. We can feel more dizzy, lightheaded when we stand up quickly, headaches, and hormone imbalances. Another big sign of starting to get into that adrenal fatigue state would be using excessive amounts of coffee or energy drinks. So if your coffee cup is larger than a venti and looks like this, then it might be a sign that you're getting into that adrenal fatigue. So that's that second stage, right? We call it adrenal fatigue or resistant stage, where it follows a prolonged or intense stress, but you're getting now highs and lows of cortisol. So not only were you gaining belly fat when you're under the alarm stage, now your body doesn't want to lose it, and it's very difficult to burn off, right? So you get adrenal fatigue that takes in, and that's when you really want to take action, because if you don't, left untreated, you can then get into that exhaustion stage. And this is actually a patient of mine, I did a salivary test. And this is a great way for you to understand what or which of those 3 stages you might be in. So it's a spit test that you do throughout the day, so 4 times, and you can actually see that her result is quite flatlined. So the green or the blue line here, you do want to be in the green area. So ideally she would start up here, come down nicely, and then slowly go down to quite low before bedtime. But in fact, she had quite a flat line, and this again is leading to things like chronic fatigue, or just really having, you know, severe issues with their energy. So leading into that exhaustion stage, that's when you have low cortisol, chronic fatigue, fibromyalgia, moderate to severe depression, anxiety attacks, more severe insomnia, cardiovascular complications, including very high blood pressure, diabetes, and other chronic concerns. So we want to prevent entering that stage altogether. So the first thing we're going to talk about is how to nourish our adrenal glands. So a lot of this is, you know, everyone knows they need to be doing all of these things, but this is, again, just a quick reminder that we need to exercise every day. It doesn't always have to be intense. And I always say, you know, and going out in nature, right? Because that can be very nurturing for, you know, your body and mind. And, you know, if you can get to a quiet place, visually and the smells of being out there can really help with supporting your adrenals and the rest of your body. So that kind of ties into relaxation as well. So slowing down, exercise, as I mentioned, is good, but not too much. If you are in the, well, definitely if you're in the exhaustion stage, but if you're in stage 2, doing too much exercise is actually stressful to your body. So you can actually make things worse by doing that. And I've seen often middle-aged women, but they begin an exercise protocol and they're exercising very hard, and they see improvements, but where they don't see improvements is in, again, that belly fat area, because they're adding more stress. That cortisol is causing more storage of fat in that area, and it makes it really tricky to burn off. So getting a good night's sleep is also important. Diet, we'll go into this further. We're going to speak a little bit about protein, and then fiber. A recommendation is 25 to 35 grams per day. Of course, reducing your caffeine and alcohol and refined foods, or refined carbohydrates, but eating a variety of whole foods. And then as needed, nutritional and herbal supplementation. All right, so beginning with protein. Protein's really important. I don't have the calculation up here, but for anyone who's taking notes, I recommend 1 gram of protein for every kilogram of your body weight per day. So if you are using pounds, that would be half a gram of protein for every pound of your body weight. So if you're 150 pounds, you want to be consuming around 75 grams of protein daily. So there's a little chart that shows some examples of, different types of foods, the amount or the size of that food, that portion, and how many grams of protein that will provide you. Protein powders, which we'll talk about next, you can get those. Generally, they contain 20 to 35 grams of protein per scoop. So the one that I'm going to speak about today is a vegan protein, and I am not against whey-based or dairy-based whey proteins, or collagen, but I just wanted to bring this one up today. So Veggie Day is a raw and organic vegan 100% protein, plant-based protein. They also make a vegan organic all-in-one, so it can be they can't call it a meal replacement because it actually doesn't have as many calories that are required, but it does contain a multivitamin and important B vitamins that you would need, again for adrenal function. So and again, I'm not advocating to become fully vegan or anything like that. I really promote everything in moderation, including moderation, but choosing plant-based protein or putting more plant-based protein into your diet does have a lot of benefits. First of all, of course, it's more sustainable. Less is needed to provide plant-based proteins compared to animal proteins. Digestibility, it's more digestible because it doesn't require as much hydrochloric acid. So this might be really important for people that have issues with reflux or GERD or have low stomach acid. Environmental impact, of course, is much lower, and the overall health benefits too. So alkalinizing versus being acidic. So it helps your body stay more alkaline because plant-based proteins provide antioxidants and fiber and other phytonutrients that you won't find in animal proteins. Again, it does have impact on all of us. So we know that greenhouse emissions, 25% of global emissions do come from food, and more than half of food emissions come from animal products. So just adding more plant-based protein in is always, a good idea for yourself and for the environment. Health Canada is also advocating this. They came out with their, the Canada Food Guide advocates this. This is their new proportion, right, that came out, with half your plate being vegetables and fruit, a quarter being whole grains, and then the other quarter being protein foods with that specific focus on plant-based. So with that Veggie Day product, it's a blend of 7. So you get pea, brown rice, pumpkin, quinoa, chia, spirulina, and chlorella. So it's a nice blend of proteins. When you have a blend of plant-based proteins, you're guaranteed to get that full spectrum of your essential amino acids, which you won't necessarily get if you were to only consume pea protein or only consume rice protein. So in addition to optimizing your nutrient intake, with protein rich foods, the other things that are foundational for our adrenals, and I'm not going to get into all of these unfortunately, but vitamin D, and again that's a whole other hour because of that connection with the immune system, as well as vitamin C, but vitamin Bs, so B complex, but in specifically vitamin B5 is very good for your adrenal health. So if you're looking for a vitamin B complex, look for one that definitely has B5 and maybe one that's focusing more on that particular vitamin. Fiber I mentioned, and then we'll talk a little bit about both omega-3 fatty acids and magnesium. So magnesium has been called or coined the anti-stress mineral. I know I'm deficient in it. When I haven't gotten a good sleep or I'm under more stress, I will get my, that classic eye twitch. Sometimes, muscle cramps that indicates that your magnesium is low. And it's low for a few reasons. It's deficient in our foods. I looked this up recently, and we know that our soils have been depleted for many years, and a vast majority of the topsoil has been eradicated from the Earth's surface since I think the late 60s. But in the early, so 1914, this is from an apple. Typical apple contained about 29 milligrams. And in 1992, a typical apple living in the same area and maybe from the same orchard even had 5 milligrams. So from 29 down to 5 milligrams in about 80 years. Again, it's that depletion of our topsoil. We also see in our bodies that depletion caused by stress because we need more magnesium when we're under stress. And certain medications, a lot of medications, in fact, actually cause depletions in magnesium. A really common one, of course, antidepressants and birth control. And a lot of people are on both of those. So those are both going to really impact your levels. It is a very important mineral for many reasons. There are more than 300 reasons, which we won't get into. But majority of its function in the body is to help support energy production, bone, teeth, and muscle health, neurotransmitter metabolism, again, straight direct connection with mood and stress levels. So your GABA and your serotonin levels. It's important for anxiety relief, sleep improvement, and it also lowers the risk of heart disease. And you can find it in food still. You just have to potentially eat more than maybe you did in the early 1900s. And choose or know your source, know your farmer, and understand that concept of the density of the nutrients in our soil. So they've got a couple nuts there that are quite high. Excuse me, hazelnuts and almonds. And in dark chocolate, I'm giving you the go to have your dark chocolate, 146 milligrams per 100 grams. So there are many different foods that will support those levels in your body. But most people, I do suggest supplementation because you're really not going to get that much out of your food unless you're eating piles and piles of those things. And again, magnesium is so commonly deficient. It is the most common mineral deficiency in Canada. There are a lot of options you can choose. I'm sure when you go to your local Netters, you're going to find probably 20 different products or more on the shelf. So you'll find everything from gummies and chewables to powders. I think there's liquids out there too that I've seen in the stores. So a lot of different options and a lot of different forms. So there's magnesium oxide, a form that I definitely would not recommend if you're trying to improve your magnesium levels, because magnesium oxide is a laxative and it's going to go right through you with everything else. That's what it's really used for. However, magnesium citrate is going to be more absorbable, and if you have any gut issues, magnesium bisglycinate is an even more absorbable form. There are forms for kids. Again, there are forms that are chewable if you don't like to swallow pills, and there are powders. So I wanted to bring this one up. It's called MoodSense. It's the most absorbable form. It's one I recommend a lot of my patients because a lot of them have gut issues. So if you've got digestive problems, it is best to take something that you know you will absorb and again, not flush down the toilet. So this one's guaranteed not to cause stomach upset. And it's got much more than just magnesium. So it's a sort of a higher end magnesium product, but it does support a lot of what we see with adrenal fatigue. So we have, we've got different aminos in there. We have other vitamins, and we've got minerals as well. Excuse me. Okay, so it's basically a one-stop shop to support that sort of stress response that magnesium is involved in. Tastes good. You can add it to warm water. You can have it as a tea before bedtime. Now, fresh wholesome food and minerals and vitamins are important. So is sleep, that's exercise. But when you need a little bit more, if you need to really restore those adrenals, then you want to take the extra step. And that would be something along the lines of a herbal adaptogen. So the question again might come up, well, what if I don't know if my cortisol is too high or too low? So I showed you in that graph, when someone does a spit test, you can determine what their levels are. Now, if you don't have a naturopathic doctor or you can't afford one right now, you can't get that test done, always look for a herbal product that is going to support your levels no matter what. Excuse me. And one of those, and there's several on the market. I like this one. There's Serenity Formula by Natural Factors. But anything that's adaptogenic. So adaptogens mean herbs that will balance your adrenal health. So if your cortisol is too high, it will actually help bring your cortisol down. If your cortisol is too low, though, it will actually help bring those levels up. So AdrenaSense has been shown to support healthy cortisol levels in both cases. Well, in fact, in all 3 stages of adrenal fatigue. So it's addressing that rise in fatigue that's experienced by that adult range. We see, like I said, most of my patients will be in stage 2, but you'll also feel better with taking it fairly soon after starting. So it can help promote restful sleep. It can help reduce stress levels or how you feel due to those stress levels, increase your energy, and also helps to relieve general debility and aids during convalescence. When I was in naturopathic school, we learned another tip that for every year of stress that you may have been in, you should do adrenal support, whether it's something like this or, you know, the whole package with your diet and exercise and proper sleep, but you should be doing that for about 1 month. So for every year of stress, you need 1 month of really good adrenal support. And for some people that might mean, you know, 2 months, that might mean a few years, right? If you've, say, been under stress for 24 years, that may mean you need to support yourself for 24 months. At least it's not the same amount of time as the amount of time you were stressed. So some of the ingredients in AdrenaSense, you can find these in other products, but rhodiola. So rhodiola is really important. Always look for extracts. So as you can see with rhodiola, extracts are important, 3.5% rosavins. So extracts of rhodiola do show a calming effect and actually can help energize the body. We see that suma is also very restorative, so it's more of a tonic, and it helps more than just the adrenals. It also helps reproductive, nervous, and digestive systems. Also very nutritive, so it contains a lot of important nutrients, amino acids, and vitamins. Schizandra, this is also good for mental health. So we see a reduced nervousness and increased physical endurance and mental capability. So really important for students as well. Ashwagandha is one of my favorites. I find most people can, really tolerate this one, and they do really well. It helps to normalize cortisol. This is your major adaptogen in here. So again, going to really balance those levels in your body. And then finally, Siberian ginseng, another really great adaptogen that supports your response to stress. All right, so another side effect of stress is inflammation, and just like 90% of illnesses have stress related to them, most illnesses have an underlying inflammatory picture. So inflammation, although is necessary for our bodies to function and heal, inflammation can also cause a host of other chronic issues. So I'm always, again, a big advocate of keeping your inflammation down, anti-inflammatory diet, and incorporating some things that will be, again, very nutritive to you, but also provide a natural anti-inflammatory response. So inflammation has been shown to be connected to anxiety and depression. One study here, a huge number of people, over 14,000 people, and researchers found that people who had depression had 46% higher levels of CRP, or C-reactive protein. And those with the most severe forms of depression also had the most inflammation. So CRP, a fairly simple blood test, it's not expensive, either through your naturopathic doctor or your medical doctor. It should be covered by your by the medical system in your province. It's like $4, I think. Basically, that's something you could always look into. If you have depression, or if you have other, concerns and you're wondering where your levels are, something to look at, because it will be indicative of the overall inflammation in your body. They also another study showed that treatment-resistant patients taking antidepressants, so those patients that were not responding to antidepressants, They also gave them aspirin. Aspirin is a non-steroidal anti-inflammatory drug. Now, I'm not promoting taking aspirin all the time, but of course, what this really showed was that adding in something that was anti-inflammatory actually provided improvement to that group, so more than 80%. And then evidence suggests that there's an increased inflammatory activation in patients with panic disorder and generalized anxiety disorder. So keeping inflammation at bay is also very important. So how can you do that? Well, good fats, right, to provide healthy levels of omega-3s and good levels of omega-6. You don't want to do too much of the omega-6 because they can actually feed into inflammation. However, omega-3 is anti-inflammatory. So we've got both plant and animal-based fats here, but omega-3s are really where it's at. So omega-3s are anti-inflammatory, but we also know that omega-3s are specific to helping with mood. So the two that we use in our body that you can get from both fish oil or certain forms of algae include EPA and DHA. So these are, again, the forms that we use. If you are vegan or vegetarian, you will have a tougher time. You won't be able to get these forms of omega-3s, but you can convert into this form. Unfortunately, the conversion is quite low. In men, you know, it's only about, I think it's like 12% conversion rate. In women, it's even less. So you really have to eat a lot of those vegetarian-based oils to get what you need. And then unfortunately, you're increasing the amount of omega-6 that you're consuming. So if you are vegan or vegetarian and you don't want to do a fish oil, then choose an algae-based oil to get these levels. So they provide anti-inflammation. They have shown to improve primary depression, have helped some aspects of bipolar. They help menopausal depression. They played a role in preventing self-harm, as low levels are associated with suicide and self-harm. And they also improve depression during and after pregnancy. So again, lots of different ones on the market. SeaRich Omega-3 is one, a liquid that I like, and it is fish-based. I like it because it's a natural triglyceride fish oil, so it's not the ethyl ester form, which is more oxidated. It's very potent, so a teaspoon contains 1,250 milligrams of both EPA and DHA in combination. It's sweet with low-calorie monk fruit, so it has a really nice flavor. It doesn't have that stevia aftertaste, but it doesn't have any sugar in there either. And it's very clean. So another thing you always want to look for is third-party testing through IFOS or iSura to make sure that it's not going to have any heavy metals or PCBs or dioxins or any kind of other residue that you might not want to be adding to your system. To add more anti-inflammatory support, another product is Brain Defense, which is herbal. So this is going to be fine for vegans and vegetarians. And this product really combats inflammation with the 5 herbs in there, and supports you with antioxidants as well. It's got ingredients in there to reduce CRP directly. So I have seen reductions in CRP with this product. And we also have seen that curcumin, so one of the ingredients, can cross the blood-brain barrier and really help with inflammation in the brain, which is difficult for a lot of things to do because our brain is quite protected. So the ingredients here include bacopa. This one's shown to treat anxiety and depression. I also find it really good for students as well. I used this when I was studying for my board exams, and I don't know, I passed, so I say it was the bacopa that helped me, but it also helped me feel more alert and calm, kind of like theanine, which we'll talk about in a moment. Ashwagandha is in there again, so again, that's your adaptogen. And then curcumin. So we have a curcumin phosphatidylcholine complex, which has been shown to be very absorbable into your bloodstream so that it can, go where it needs to go. Boswellia is an anti-inflammatory as well. I will use this also in people who have had brain injury, stroke, or concussion. And then chamomile extract, which is calming and anti-inflammatory. They call it the herbal aspirin, and it's also effective in the treatment of depression and anxiety. So if you're more on the herbal side of things and you want some anti-inflammatory component, this one is a nice formula. All right, so we've pretty much gone through that, but again, it will help lower your CRP levels, help you combat sort of the inflammation and oxidation that you might be generating just by being under stress. Now, if you have, on top of that, issues with mood, right? So stress levels are one thing, we're aware of them, we know we need to prevent adrenal exhaustion. If we want to help lose that belly fat, we need to support the adrenals. But if it's also really impacting how you're feeling mental, emotionally, you want to target that too. So mood imbalances have serious and complex impacts on the rest of the body. Women are up to 40% more likely than men to develop mental health conditions and more likely to report having suffered from depression. And as I mentioned, medical research suggests 90% of all illnesses and diseases stress-related. Every minute, changes in stress hormones can have a significant effect on mental and emotional health. And chronic stress can cause problems with concentration, depression, anxiety, insomnia, ADHD, and memory issues. Now, hopefully, you know, if you do suffer from things like this, depression or anxiety, you're not taking a concoction of different things. You know, there are very important pharmaceuticals for treating some of these conditions, but like this little advice station, it is important to never take a pill that has more side effects than you have symptoms. And unfortunately, a lot of them do. Often for anxiety, the drug of choice will be sedating or a hypnotic medication, which of course these can be very addictive and not very good for long-term use. Lots of side effects, so dizziness, drowsiness, and depression, that's not great, loss of libido and weight gain, and memory issues, and of course can potentially be dangerous, as a lot of these medications you can't drive a car, and if you combine alcohol consumption, it can be also potentially fatal. In the US, I don't have a stat for Canada, but taking some of these medications is estimated to contribute to almost 500,000 premature deaths every year. So instead of going the pharmacological route, if you don't have to, you know, first look at where maybe your brain waves are. Now, you can't get an expensive EEG, but understanding sort of what's going on in your brain can help you to understand maybe other natural things that you can do to support it. So in this picture, there are different waves that are occurring in your brain depending on what you're doing. So most of us at the bottom here are in beta. So when we're awake, we are producing beta brain waves in our brain, which is because we're awake, we're excited, we're multitasking, we're thinking about the future, we're thinking about the past. And that's very important. But if you are in that state while you are trying to sleep, or when you're trying to think more rationally, or again, you're trying to sort of be more introspective into what's going on, you're going to have a hard time. Alpha waves, on the other hand, are also occurring when you are awake. These are more relaxed brain waves, and these will actually help you to get into a sleep stage like the theta and delta waves, and they are also more conducive to healthy immune system, healing, and lowering inflammation. So one thing that supports alpha brainwave activity is something called L-Theanine, which is found in green tea. Now you have to drink a lot of green tea to get the amount of theanine that really can help with calming you. So again, this might be something you'd want to supplement with, but it is an amino acid that supports alpha brainwave activity and also helps to increase GABA, dopamine, and serotonin, which are all involved in relaxation and healthy mood. It's also helpful for anxiety, nervousness, and sleep disturbances, PMS, ADHD, weight control, and poor concentration. So if you drank 6 to 8 cups a day, you may get between 200 to 400 milligrams, which is usually the recommended intake, but you're also getting potentially a lot of caffeine, which could counter it. So for L-Theanine, I like the chewables because they are fast acting. So, you know, if I go in front of an audience, a larger audience that I'm used to or something, and I'm feeling a little bit anxious, I will chew 2 of these about 20 minutes beforehand. And you get a nice drop in that sensation of anxiety. You feel more grounded, more present, and you're able to think more clearly. So these are really good for that purpose. This particular theanine is from L-Theanine. It's a patented process to get it out of the green tea leaves. It's a fermentation process that mimics that process in the green tea leaves done through bacterial fermentation. It's considered GRAS status, which is generally regarded as safe. That's the same status as your drinking water, if you have good drinking water. It's also been used, not basically off-label, I should say, but in kids and elderly. So children usually do half the adult dosage. And again, no side effects. It's not habit forming. It's not going to cause any drowsiness. Just helps you feel focused and calm. But if you need a little bit more support and the theanine is not working to increase your GABA levels, you can take GABA directly. So again, GABA is what theanine will support. It is a neurotransmitter in the brain. Again, helps you feel calm and grounded. There is a receptor in the brain that GABA will attach to help you feel that way. There are other things that will attach to that receptor. So many anti-anxiety drugs, anticonvulsants, and even alcohol will bind to this GABA receptor. And that's often why alcohol can create that more depressing effect, sort of calming effect. So GABA you can also get in chewable format, again, just so that you can have that response more quick. You can get it in a pill form too, if you want to swallow it, if you prefer that. But the chewable, I do like because of how quickly it can work. And it's also made by a fermentation process using the same bacteria that the Korean vegetable dish kimchi is made. So natural fermentation process. And again, it's not drowsy. It is not habit forming and does not have any safety issues. With the exception is if you are on certain pharmacological medications, you'd want to check with your healthcare practitioner. And then finally, if you've got some concerns with more of a happy mood, so if you've got issues with depression, there are other things you can take, such as MoodSense, which will support 5-HTP, which converts to serotonin in your body. So 5-HTP is one ingredient to promote that. Saffron extract is in here as well. This has been shown to possibly increase serotonin levels in the brain more significantly than 5-HTP, but in combination, those two are excellent. And then lavender, which is calming, and vitamin B6, which is necessary for the production of serotonin in the active form of P5P. So again, when we talk about vitamins, active versions are going to be much more effective in you than inactive or synthetic forms. And then finally, magnesium bisglycinate, which we already spoke about, that very active form of magnesium that's absorbable, again, to support the production of your healthy neurotransmitters. Now, 5-HTP also will help you with sleep. And insomnia is another big issue that we deal with in Canada. Again, I don't see any of you. I can't ask you to raise your hand if you have sleep issues, but it is very common. And there are a lot of complications that can come from this, whether it's, weight issues, high blood pressure, immune system function. Okay, really key right now to get your hours of sleep, to get your immune system, super, super healthy for when fall comes in. Now, we know that insomnia stress does affect a lot of us, as I mentioned, and it's really interesting how it's connected also with cortisol. So researchers showed that after only one night of sleep restricted to 4 hours, so say you do shift work or you're up too late, you're Netflix binging, I don't know, you slept for only 4 hours, cortisol levels were 37% higher that next day. And that's only after one night of restricted sleep. So you can imagine if you have multiple, nights in a row, or, one night every few days of limited sleeping hours, your cortisol will be increased. Now, cortisol, of course, we talked about all those things that it will do in your body. And it also impacts melatonin. Melatonin is your sleeping hormone. It is secreted when it's dark, so stimulated by the dark. And it's also secreted when the cortisol is low. So low, normal, but low. And of course, if you have higher stress due to restricted sleep, it's going to be more difficult to fall asleep. So it's quite a vicious cycle there. It's also very important, though, to know that cortisol, having enough cortisol is absolutely necessary to allow for REM sleep. So rapid eye movement sleep, that REM sleep, that is the restorative sleep. That's when you are repairing and your liver is, functioning and detoxifying, any wounds are healing, your muscles and joints are, repairing from a hike you did the day before. That REM sleep is really important. It's the highest quality of sleep. And so if you don't get that REM sleep because your cortisol is actually too low, even if you sleep 8 hours, you're not going to feel rested when you get up. So you need to have enough. And that's, again, why adaptogens are so important, because if your levels are too high or too low, they will help in both cases. So again, you can see that vicious cycle there between stress and cortisol and melatonin. So it is a problem. We know that in Canada and in the world, 1 in 7 Canadians over the age of 15 have trouble falling asleep. Many of us are reporting less than 5 hours of sleep. And this is kind of scary. 31% of adult drivers reported falling asleep at the wheel once in their lifetime. And, maybe you're not even going to admit that. So I imagine that number is actually higher. And depending on where you live, I know I lived in Vancouver for a few years, and that maybe if you live in some of the other larger urban centers, commuting time, right, it's gone up. Maybe not right now if we're all working from home, but commuting time over the past 20 years has increased by about 150 hours. That's a month of our lives. So huge changes. And where are we sacrificing that? We're pulling it out of our sleep. All right, so lots of issues there. So when we talk about improving sleep, we want to target falling asleep, we want to target staying asleep, and then we want to target our adrenals so that we wake up feeling refreshed and fixing that cortisol issue so it's not too high or too low. Other things we can do, of course, is eliminate those inhibitors of sleep. So caffeine, of course, don't drink caffeine before bedtime. Some people, like myself, I have a genetic, I won't call it a defect because I'm happy about it, but I can drink coffee and go to sleep and wake up fully refreshed because one of my genes is actually in my liver function, works very effectively to break down caffeine. So I don't have that issue, but a lot of people do. And a lot of medications will also impair your sleep. So utilize natural sleep aids as much as possible so it doesn't become habitual and you're not addicted to that. You also want to look at stabilizing your blood sugar. That's a great way to do that is with fiber. Sometimes even having a little bit of fiber before bedtime can help because that will help balance blood sugar levels throughout your sleeping hours so that you don't wake up either in a low or high blood sugar state. And then of course, supporting your adrenals. Healthy habits for sleeping would be making sure your routine is down, right? If you need to relax, take a bath, meditate, listen to music, etc. And then again, here's your snacks. So fiber, which is calorie free, or if you want something with a little bit more substance, make sure it is going to be higher in protein. You don't want to be focusing on carbs right before bed. And then a relaxed sleep environment. So no lights, no electronics, quiet, cool temperature. So the blue light coming from screens or the street lights, those both impact melatonin production. Blackout blinds can work very well for people. All right, so we're just about finished here, but I want to touch on natural things to do for sleep. A really important ingredient, of course, is the hormone that we have in our bodies, and that would be melatonin. So melatonin is secreted by the pineal gland in our brain. So if you take 5-HTP, which converts to L-tryptophan and serotonin, that will support it. You can also take melatonin directly. So taking that will help reset your circadian rhythm, and there's many different strengths out there. You can get anywhere from 1 to 10 milligrams or maybe higher. I'm usually using a lower dose for people to start because high dose can give you nightmares or very vivid dreams. And 10 or 20 milligrams becomes more of an antioxidant, which is good, but it has those side effects. But it has been shown again for really supportive for the immune system and in certain cancers. 5-HTP is another one that's really helpful for sleep, again, because it converts into serotonin, which converts into melatonin. But serotonin itself has an impact on our sleep by supporting the quality of our sleep. Not so much falling asleep, but more staying asleep. This is also very well absorbed and crosses the blood-brain barrier, so you're going to get it into your brain where you need it. And you can also see improvements in things like fibromyalgia, depression, anxiety, and also obesity because it supports carb cravings. So as I mentioned, things can help support your ability to fall asleep. So theanine, right? We talked about that, to helping you feel more grounded in the now, right? If you have active mind before bedtime, L-Theanine to help support that, get you out of busy beta and into alpha. The other thing you would take would be melatonin, right? That will help you get right into your first stage of sleep. So when you have your first stage of sleep, you go quite deep and then you come up, and that's where you have your first set of REM, right? As I mentioned, REM sleep is really important for repair. You have to have REM to have a quality sleep. You do spend a little bit of time in REM, and then you go into another stage of sleep where you may not spend so much time or go as deep, but then when you come out, you have another REM cycle. So that REM, it gets longer. So the longer you sleep, the longer your REM is going to be. So overall, an uninterrupted sleep will provide you with better quality because your REM will, the summation of all that REM together will help you. So to support that, we also look at, again, 5-HTP. So 5-HTP, melatonin, and L-Theanine to promote a healthy sleep cycle, no matter what your issue is with sleep, whether it's, again, falling or staying asleep. All three of these you can find in something called Tranquil Sleep. I swear by this when I'm traveling. I love it. Again, chewable because it's going to be faster acting. Melatonin to provide you that initial sort of sedation, basically your natural hormone to fall asleep, but then that Tranquil or the L-Theanine to calm your mind, and that 5-HTP to help you with the maintenance of your sleep cycle. Now, if you're not a fan of melatonin or you don't need melatonin, so younger people don't always need melatonin. If you're traveling, on the other hand, it would be a good option. But if you want a melatonin-free product, then again, many things you can choose from. Restful Sleep is one that I like that is only herbal. It's got 4 non-habit-forming herbal extracts used to help support restlessness and insomnia. So this one is going to have, it's got passion flower, California poppy, skullcap, and linden. And the recommendation for that is 2 to 4 capsules 1 hour before bedtime. So a little bit earlier than you would take a chewable. And you want to start low with this one and go up to 4 as needed, because you don't always need to have this much. The passion flower is very calming. The California poppy is also analgesic. So this product not only helps you with healthy sleep and insomnia, but it can also support pain. If you've got pain at night, the bottom point there provides an analgesic action. So especially nerve pain, a lot of people that I see again will have their pain really flare up at bedtime, and then that's really interfering with their ability to stay sleeping. Okay, so we've covered now anxiety and insomnia and stress, but just a couple others to consider, because I did quickly mention vitamin B5. If you're looking for an B complex, you can get tested for a lot of your Bs, or take an active B complex. Active B complex, you're going to spend a little bit more money, but you're going to get the B vitamins in their active form. So they're directly used by your body. You don't have to worry about converting them. And there are some genetic defects that do occur in us that actually impair our ability to utilize B vitamins. And then secondly, actually, I'll just bring up, this was an interesting paper about B vitamin supplementation and its effects and improvements on depressive symptoms, anxiety, and stress. some more recent. But the other thing I wanted to mention was probiotics. Lots of information coming out in this field regarding that in the microbiome. We know that different species, genus and species like Lactobacillus and Bifido do have quite a profound effect on our HPA axis. That's our hypothalamus pituitary adrenals. And we do also see gut microbiome can affect inflammation in the body and also directly affect mood. Here's an image that kind of shows if you've got dysbiosis, that means you have not enough good bacteria or too much bad bacteria. Symptoms of that would be bloating, or if you're on an antibiotic, or you've got loose stools, or even constipation. The list goes on. Basically, dysbiosis can really affect, some of the neurotransmitters in your body. So GABA and 5-HTP, which directly will impact the brain. So we're going to start seeing more and more of this, I imagine, in the coming years, where probiotics are not just for our gut. I mean, they are, but they are directly affecting other parts of our body as well. So in this case, this one is called Calmbiotic, and it's actually only a combination of 2 bacteria, but you can see those bacteria are very specific. They have letters and numbers after their name. That means that they've been studied specifically. They are like a substrain. And those particular strains and substrains have been shown in combination to reduce stress, moderate general feelings of anxiety, promote healthy mood balance, and relieve stress-related gastrointestinal complications. So this is a really cool product because it is bacteria, it's probiotics only, but it has been studied in humans and in clinical trials to actually have or show improvements in both how the people were feeling in the study, but also what was going on inside their body. So when they did the study with this particular product, they showed that before and after the stress tests were done, and those taking this particular probiotic blend felt better. So they were subjectively improved. But then on top of it, they tested the participants' cortisol levels in their urine, and they found that taking this particular probiotic increased the level of its excretion. So in other words, or decrease, sorry. So it showed that the level of cortisol, free cortisol, had lowered, and the metabolites of cortisol, or the breakdown products, had increased, meaning the people were healthily breaking down their cortisol, so they weren't exposing their bodies to a high level of that stress hormone. So they showed that the cortisol levels improved, and that symptoms also improved, such as stress-related abdominal pain, nausea, and vomiting, and then that neurotransmitter function was influenced. So suggesting that GABA, serotonin, and other chemicals were modulated to really support, again, behavior and function. All right, so in summary, and again, we're gonna have this recording for you all, but this is a great one to focus on, this slide. Just a summary to combat stress these times that we're in right now, how to make sure, our anxiety doesn't go through the roof, and if we're feeling pretty unrested, how to get a better night's sleep. So it all starts with level 1 support. Again, the foundation, the basics, make sure you're eating well, getting enough protein, fiber, B's, magnesium, omega-3 fatty acids, probiotics for sure, whether it's a generalized one or something like Calmbiotic, vitamin D, and then overall anti-inflammatory and antioxidant foods, exercise, and relaxation. And that's all. And level 2 support would be on top of level 1. So level 1 would be additionally, if you feel like you have sensation of anxiety, or you've got active mind before bedtime, you could add L-Theanine in, right, to deal with that occasional stress. And if you need to add even more, you would then layer level 3 on top of that. And that's where you could use more adrenal support. So that's looking at taking GABA in addition or instead of L-Theanine, and then adaptogenic herbs, but taking that twice per day. So something like AdrenaSense or Serenity Formula twice per day to really support that energy. And then you can always add support for low mood if you have a little bit of that, and natural sleep aids. if you do have issues with falling or staying asleep. And then one of my favorite things to do if you've got a forest near you is decompressing from stress. Forest bathing has been shown to reduce stress hormones, blood pressure, pulse rate, heart rate variability, and also increase your immune system by increasing the body's natural killer cells. Meditation helps, yoga, exercise, jogging, listening to music. I mean, the list goes on, but find the thing that you love to do and try to integrate it into every one of your days. Now, everyone always asks me what are my favorite supplements. Well, I don't have so many, but when it comes to this concern that we're covering today, these are my 6 to really focus on. And you can have a variety of them, but really to help with all those levels of support. I didn't talk about D3 in length at all, but I do think that's something that everyone really should be taking. And if you have any concerns with heart disease or osteoporosis, combining that with vitamin K2. I had a little asterisk beside all those supplements because I also think it's important to know where your products are coming from and to know also that they are being tested to make sure that what you see on the label is actually in the bottle. So iSura is one facility in Canada. It's actually been considered the world's best in contamination and GMO testing. And it is in Canada, which is pretty cool. It's a not-for-profit organization, and it's using a few different methods to detect over 600 different things. So that's anything from pesticide to herbicide residues, solvents, heavy metals, dioxins and PCBs. It's testing for glyphosate, if that's a concern for you. And it's of course going down to the levels of parts per billion. So when you see iSura on your supplements, know that your products are non-GMO, but you also know that they're going to be free of things like glyphosate and another 599 very potentially toxic chemicals. All right, so I will close there and thank you all. Again, I have a few things that, so references that you can always refer to. There's a really interesting adrenal stress test. So if you're curious, you don't want to go and do that expensive urine or salivary test, you can do the adrenal stress test here at womensense.com/stress-test. That helps to determine your levels and maybe what area you should focus on. I also have a neurotransmitter assessment on my website that you can find under resources. Again, it's a fairly long questionnaire, but it's been shown to be linked very closely to what you might find, again, on a very fairly lucrative and expensive urine test. So I like to use this a lot with my patients. That'll help you to understand, where your levels of GABA and serotonin may be resting. And then finally, there's some of my social tabs. Right now in Canada, it's Naturopathic Medicine Week. So I know lots of different provinces are partaking in this. And I know in BC, if you're a BC resident, there are some contests you can enter every day to win. I think it's $175 that you can use towards any naturopathic appointment with anyone you want in your province. So not just me, I'm not promoting that for me, of course, but something to consider if you're ever interested in getting a little bit more support there. It is Naturopathic Medicine Week, so we'd love the support. All right, so I understand, well, we went a little bit over today, so I'm going to answer the questions that have come up. There's 2 options here. I've got a Q&A and then the chat. So I'm going to go through these. If any of you have to leave the call, I totally understand. And then just really thank you for all your attention. And a big thank you to Netters for setting this up today. So let's see the questions here. I've got the first one here. Hi there. I'm wondering if you know if someone can have severe back pain with adrenal fatigue, or is it typically dull, achy pain? Yeah, so that's really interesting. I would say both would be possible with adrenal fatigue. I don't know that there would be one more, specific to adrenal fatigue than the other. It really has to do with things like inflammation, right? So because with adrenal fatigue, your inflammation goes up. If you have a history of an injury somewhere, it could flare that up. So that could be severe back pain. If you've got scoliosis or a structural issue, flare that up. Or again, it could just be a more dull, inflamed sensation throughout the body. Some people say they feel more swollen or flabby, or, you know, fatigued muscles and things like that. So I don't think there's, you know, one that's more specific than the other, and that both could potentially occur with adrenal fatigue. And then the second question was, this is a great question I get a lot. Can you use L-Theanine during pregnancy or if trying to get pregnant? The correct answer should be no, because it's not been tested on pregnant women. So during pregnancy, I would say no. However, you know, scientifically, if I'm looking at it, there doesn't seem to be any reason why, you know, that would be a concern, because it is a naturally occurring amino acid and it is in green tea. If you're trying to get pregnant, again, there are no studies on that, but that would be completely fine because it doesn't affect fertility in any way. So that's the answer to that one. Let's see, I have a few other questions that during the chat. So I'm going to just call out your name if that's okay and answer you verbally. So Stephanie had asked earlier that amount of protein compared to body weight that you should consume every day. So yes, 1 gram of protein, you should consume 1 gram of protein for every kilogram of your body weight per day. Or if you have your weight in pounds, you can divide by 2.2 to find your kilos, or simply just do half of that. So half of your weight in pounds would be the grams of protein. 150-pound person, you want to consume about 75 grams per day, divide it up. So that would be, you know, 25 grams and in 3 meals, to be really simple. And that's, again, kind of like the minimum. That's sort of the amount shown to really, you know, keep your immune system healthy, keep your muscle mass healthy. If you're an avid, you know, athlete, runner, if you're doing a lot of, you know, CrossFit or weight training or things like that, you need more support. Your numbers will definitely go up. I do up to 2 grams per kilogram per day. And then if you've got any issues with, you know, kidney function, you will have to actually reduce that number. So if you do have any issues with your kidneys, check with your healthcare practitioner first. All right. So question about the recording, and I believe we have recorded it. So I believe that Nutters will be sending that to you. That was from Sandra Campbell. Oh, you got answered anyway, I'm sorry. Okay, and I think I've got a lot. Thank you very much for the thank yous and the informative. And yes, we'll be sending this out to all of you. So I think that looks like that is all.
I think we actually have one more question in the Q&A section if you want to grab that.
Yes, just saw it. Thanks, Michelle. Okay, so yes, I got a question. I'm entering menopause and was taking a menopausal supplement daily plus black cohosh, but read that it is not advisable to take this type of supplement longer than a couple months. Okay, so imagine you're asking why would that be? So to be honest, black cohosh is a very safe herb. Whenever we see these types of health, these cautions, it's all dictated by Health Canada. So it's not really about what's in the product, but it's just about what needs to be on the label. So the real reason that I say to people like yourself or to my patients would be, is if you're taking it for a couple months and you've improved, great. You probably want to try going off of it just so you're not taking supplements, you know, forever. Or if you're not feeling any improvement, you want to speak to your healthcare practitioner because it's not targeting your concern. So it's really all about you being accountable for yourself to make sure that after a few months, if you do or not, or don't notice a difference, that you maybe switch it up a little bit. But honestly, it's safer longer than 2 months. Absolutely. All right. I think that is it for questions. Was there anything else, Michelle, that you wanted to say?
I don't think so. Just thank you so much. This was such a great presentation, lots of good information. And to everybody who's still on the call, we'll have the recording out probably tomorrow. So hopefully you'll have the link if you want to reference anything that we talked about today.
Wonderful. Thank you, everyone. Thank you, Michelle. Thank you, and others. And all have a great evening.
Thanks, Jen. You too.
Thank you.